Today's video will be on the healthcare delivery system. The healthcare delivery system is massive and complex. A healthcare delivery system consists of people, institutions, and resources that strive to meet the healthcare needs of people. Many organizations and individuals are involved in the healthcare delivery system. The key players in the healthcare delivery system are education, research, suppliers, insurers, providers, payers, and the government. This system is important because it strives to evolve, provide better patient outcomes, and promote health. As nurses, understanding the healthcare system is important because it will allow us to better direct patients and their care. Who are the providers? Healthcare providers are at the heart of healthcare. Healthcare providers are physicians, nurses, dentists, therapists, dietitians, pharmacists, and others who influence various healthcare settings nationwide. Providers also include, but not limited to, health departments, physician offices, community health centers, dentists, home health agencies, hospitals, rehabilitation centers, skilled nursing facilities, nursing homes, and diagnostic clinics and hospices. Providers are in a caring role in which knowledge is critical for quality care. What do providers do? Providers deliver healthcare services and care to people. Providers play a role in diagnosing, treating, consulting, preventing illnesses, and giving patients advice. A provider promotes care, comfort, relief of pain, and support for patients and families. Physicians evaluate patient health conditions and diagnose and treat health conditions. Their goal is to prevent illnesses. Nurses are the major caregivers for the sick and injured patients. Nurses are the largest group of healthcare professionals. Dentists diagnose and treat dental problems related to teeth, gums, tissues of the mouth. Therapists provide care for patients with movement dysfunctions. Dietitians screen and assess patients using nutritional-focused exams to develop nutrition plans for patients. Pharmacists dispense medications as prescribed by physicians. How does each provider create or address inequity in healthcare access? All providers can address inequity in healthcare access by engaging with policymakers and urging actions to help those with disparities get equal access. They can call or write to elected officials. Inequities in healthcare and health status are driven by law and policy. Physician and nurse shortages create inequities in healthcare access due to the inability to access providers in the U.S. According to Finkelman, nurses need more knowledge about culture and health needs, health literacy, how different groups respond to care, and health disparities. This will address inequity in healthcare access. Educating all healthcare professionals and providers about the inequities will address the healthcare inequity issue. A better understanding of health inequities will assist with addressing inequities in access. What are healthcare settings? Settings are the locations where healthcare is provided. The main difference between inpatient and outpatient ambulatory settings is you stay overnight. Inpatient settings include acute care hospitals, rehabilitative care, long-term care, nursing homes, and end-of-life hospice care. Inpatient settings are for hospital or institution stays and medical emergencies. Inpatient settings allow for closer monitoring. Outpatient ambulatory settings include primary care physicians, ambulatory or outpatient care, urgent care centers, home health, community care clinics. Outpatient allows you to go home on the day of the procedure due to non-emergent status. How does each setting create or address inequity in healthcare access? Settings address inequities in healthcare by improving patient access due to the variety of settings available. These settings can address inequity in access by providing cultural training to healthcare providers. Invest in the public's health through expanding access to clinical preventative care and community investments, making healthcare available for more diverse populations. Ambulatory settings address inequity by being convenient to obtain services that are typically cheaper than inpatient stays. Inpatient settings address inequity by allowing for care that an individual may not have outside of a medical facility. Inpatient settings cost more, making people not want to obtain the needed health care. What are healthcare purchasers? Purchasers are insurance, government, and individuals who buy healthcare services. This is an individual or an organization. Insurance company insurers are Blue Cross Blue Shield, commercial insurers, employers, third-party administrators, and state agencies. Government purchasers are public insurance financing. The U.S. government is the largest purchaser of health care services in the U.S. Individual purchasers are anyone who purchases health care. This can be anyone who is either self-insured or underinsured. How do health care purchasers work? Insurance purchasers work to provide health coverage to insurance companies and individuals. They protect the insureds against financial catastrophe by providing health care services. The government-run programs finance and ensure health care for select groups of people who meet each program's criteria. They work to ensure health care coverage for a large part of the U.S. population. They expand insurance coverage to those who would not be able to afford health care. If an employer doesn't offer health care, you must purchase your own health care, apply for government health care, or go without insurance. The largest government programs are Medicare and Medicaid. Individuals are anyone who purchases health care. This can be an individual, company, or corporation. How do healthcare purchasers address or create inequity in healthcare access? Insurance companies create healthcare access inequities. Having high monthly insurance premiums and high deductibles makes it unaffordable for individuals and companies that provide health insurance to their employees. Insurance companies determine what is covered and what is not. Insurance companies can charge more or refuse insurance to people with poor health or pre-existing conditions. This causes people to not have health coverage. The government addresses and creates inequity in healthcare access, providing Medicare and Medicaid to those who meet the qualifications that otherwise would not have health care or insurance. The government has invested in the public's health through expanding access to clinical preventative care and community investments, making health care available for more diverse populations. Inequities in health care and health status are driven by law and policy. Individual purchasers address inequities in healthcare access. Purchasing healthcare for those who need it addresses inequities in access. This can occur by public or private insurance coverage. Expanding healthcare is an essential measure for equitable access to healthcare. The healthcare system is complex, which is attributed to inequities in healthcare access. The cost of healthcare contributes to inequities in healthcare access. The always changing healthcare system provides inequities in healthcare access. The Affordable Care Act expanded insurance coverage to improve inequities in healthcare access to reduce the uninsured. The Affordable Care Act is designed to benefit all socioeconomic, racial, gender, and age groups. CHIP increases low-income children's access to health care. This concludes today's presentation on the healthcare delivery system.